clinical situations where this path of insertion or the path of placement is going to play its role. So if I talk about first class 1 Kennedy situation, what is class 1 Kennedy's situation? Class 1 Kennedy's is bilateral edentulous area across the midline, bilateral posterior edentulous area across the midline. So now when we talk about a class 1 Kennedy situation, there are less chances of single path of insertion, less chances of one single path of insertion. So that means there are more chances that this RPD might get dislodged because there is not one single path of insertion. Why? Because in class 1 Kennedy situation you don't have any posterior abutment teeth to dictate that movement, right? Only anterior the teeth are present. So a limited amount of path will be preserved for insertion and removal, but from the distal side if you see there is no teeth, right? So there are chances that the RPD might get dislodged, right? But this can be corrected. Okay, this can be corrected by the proximal surfaces of the abutment teeth. Okay, so that is what you need to keep in mind. You need to place some additional rest or indirect retainer so that there is one single path of insertion. Additional rest or indirect retainer has to be placed, right? Now what do you mean by additional rest or indirect retainer? See, indirect retainer are something which indirectly retains the prosthesis. The name itself is saying direct retainer are going to be on your primary abutment teeth. What do you mean by primary abutment? Suppose this is the arch, here you have your one premolar, here premolar, all other anterior teeth are present. Posteriorly it is an edentulous area. So this are your primary abutment. One, you have class assembly over here, so that is giving you some amount of retention and a single path of insertion, but apart from that you can give extra occlusal rest on the lingual surfaces of the anterior teeth, right? So when you do that along with the primary abutment, your secondary abutment also play their role in path of insertion, correct? So this is about Kennedy's class 1 situation. When you do this, that time there are no chances that the RPD can move from this direction or this direction. There are more chances that there will be a single path of insertion. So what do we understand from this? From a single, for every single patient or for every single Kennedy's classification, there are some things which we have to keep in mind. Suppose now we understood that class 1 needs additional rest and support or indirect retention so that the path of insertion is maintained. Okay, the less are the path of insertion, the lesser are the path of removal, the more will be the retention of the prosthesis. Path of removal matlab there are n number of ways through which the prosthesis can come, but if you are restricting that n number of ways and bringing to one or two ways where the prosthesis can come out, because it is a removal prosthesis, you have to find a way that it comes out easily also and patient can wear easily also. So you need to restrict your path of removal. Okay, there should not be numerous path of removal so that the retention is not affected. Now